Now, one place where the intervention of the armed forces will be rather more welcome is in London's hospitals. Hundreds of troops, a British Army, have been sent in to wards to help relieve some of the pressure on overwhelmed NHS staff. With me is Mark White, our Home and Security Editor. So, Mark, what's the situation? How many have actually gone in from the armed forces and what are they going to be doing?
Well, at the moment, it's 200 at a number of trusts in the London area to help out. Now, 60 of those are actually medical staff from the ranks of the military tri-service, as I understand it.
Right.
So Army, RAF, the Navy, they'll all help out as required.
Are they generally sort of paramedic trained rather than actual doctors?
So you will have doctors and there will be nurses from the Army Medical Corps as well, and the other military medical corps within the other services who can help out. But actually, the most of them are going to help in things like portering, you know, that kind of issue. It's a staff crisis.
Logistics almost.
Yeah, and it's a staff crisis that is building across the NHS as elsewhere in the public sector and private sector. We're all being hit by Omicron and people are isolating. It's being felt acutely, of course, within the NHS because there are patients with Omicron. It's being passed really quite rapidly throughout hospitals. There's been a 60% increase in recent days in the number of absences. 35,000 people, I think, across the NHS who are currently isolating at the moment because they've tested for Omicron. And those jobs need to be filled, obviously, in order to continue to give patient care.
And those NHS staff that are off, how many of those are actually ill and how many of them are effectively being ordered to self-isolate even though they're asymptomatic? Do we know? I think the majority are, and probably the vast majority are not ill, but have tested positive for Omicron. But they have to follow the rules, and the rules say that they have to spend a significant period of time isolating until they can come back to work. And that's where the problem is arising. And because there is such a spread of the infection within hospitals anyway, we know that's been a problem right from the start with all the various variants of COVID, particularly with Omicron. It's spreading to members of staff really rather quickly. So you have got now 200, as I say, involved in the 200 members of the military involved in London. And these are all in London trusts.
Yeah.
Is there any way they could be spread out across the country? Are there more?
I think so, Isabel, yeah. The various heads of the militaries have been talking about the potential for assisting in other parts of the country if they're required. We should say there are 1,800 military personnel who have been involved in helping out across the country anyway because of this Omicron variant. If you remember, of course, before Christmas we had a crisis within the ambulance service in Scotland where they were requiring, because of the caseload and the number of paramedics who were off, help, and they received military assistance. So I think we're probably likely to see more military personnel rolled out to other NHS trusts. Remember, we've got at least, I think, 18 NHS trusts that have declared critical incidents because of the rate of Omicron spread within their hospitals and obviously the staff shortages.
So the government will just have to hope that we are actually at peak Omicron at this point, because it can't get much worse in terms of the NHS. Well, maybe it can. The
good news is that despite obviously the staff shortage, because there's a linger effect that they have to stay off for longer, we appear to have kind of plateaued, I think, in London, and the cases are beginning to subside. So,
and actually, we've not seen awful pictures of patients in corridors or being treated on floors, and you know, some of the dreadful stuff you quite typically see in a winter crisis for the NHS. So hopefully we're nearing the end of the worst. Thank you very much, Mark White.